Thank you for joining. If you're just joining, so we want to talk about um, normal tests, but no pregnancy. That's what we want to talk about today. You've done every test there is to do, and yet you are not pregnant. It's normal. Everything is normal, right? Right. Normal tests, but no pregnancy. They said everything is normal. Every test they asked you to do, you've done it. They said everything is normal. You are fine. Your results are normal. And they say, just keep trying. Right? Right. For many couples, this word means temporary relief. It's temporal. But after the temporary relief is followed by deep confusion months later, right? Because you just went home and keep trying, everything is normal, but months later you still not seeing results. Pregnancy still doesn't happen. It's because normal tests without uh, when you test without any results, first of all, you have normal test, getting the pregnancy is a painful thing. It's a painful thing because you want to ask the question: if everything is normal, why am I not pregnant? Yeah, and such is the case of many people today. Such is the case. If everything is normal, why am I not pregnant? So let's begin to ask the question, right? Or rather, let's begin to answer the question. What normally mean in medicine? If your practitioner, your health care giver says normal, what does it actually mean in medicine? Well, the truth be told, normal does not necessarily mean optimal. It does not mean it's an ideal, your case is an ideal situation. It does not even guarantee fertility, even if you are told it's normal. What normal means is that your test result fall within the the normal population range. Because we look at these things in statistics. So don't worry about that. Right? But it just means that when we look at the general population and how people should be, you fall in that category. That's what we're talking about. Right? So you do not fall in the category where we say something is wrong because your results looks normal. But you understand fertility exists in a spectrum. Spectrum means there are those in the extreme end, and in this extreme end this way, extreme end that way. Then the general people at the center. So that's what spectrum is. So fertility exists in spectrum. It's not just a two-way traffic. Yes or no, no. You're right. So if you have that idea, you begin to appreciate where the difference is. Because two of you can have the same challenge. 6 months later, one person become pregnant and you are still there for 5 years. And you begin to, was it not the same normal they gave us? Why is my own different? Because the challenge is in the spectrum, right? Now, fertility depends. Fertility depends on timing, right? And if you've learned anything so far since we begin this season, you understand we'll be talking about fertile window. We're talking about fertile window. So fertility depends on timing. Fertility depends on cellular quality. What does that mean? Cellular quality means the quality of the sperm, the quality of egg, the quality of the embryo. So that's what fertility depends on. Fertility depends on hormonal patterns. Why? Because what drives fertility largely is hormones. So, and that's of course why they will test you, hormonal test and all that, right? So, fertility depends on hormonal patterns. Fertility will depend on the function, yeah, right? Your functional health, not just the structure. For example, you go to the scan and everything's all right. That you have ovaries does not mean that the ovaries are functioning properly, right? So it depends on function, not just the structure. Many fertility problems are really dynamic. It's not just a stationary one peg fits all situation. It's actually dynamic. Now, if you remember anything at all we've said before, for example, you can have regular ovulation, right? But now we have told you that stress can shift your ovulation, delay it, or even suspend it altogether. So that's what dynamic is. So fertility depends. Many fertility problems are actually dynamic. So you want to look at it from that perspective. And it's also cycle dependent. Yeah, it's cycle dependent. So tests may look normal. Tests can look normal, but the function is impaired or abnormal. So that is the direction I want you to begin to look. Now let's talk about common hormonal tests, or rather, not hormonal tests, common normal tests, right? That may still hide some problems, right? We'll begin with hormonal tests. We'll begin with hormonal tests. Now, we for hormonal tests, see a single normal hormonal levels does not confirm regular ovulation. You know, say okay because I did this hormonal test 2024, therefore everything is all right. Like I consult with people online a lot, and I get to receive their test. And one of the things I notice is that some people will be sending me tests of 2023, 2024. It's funny because that is too long ago, right? Blueville is here, right? So a single hormonal test level or hormonal levels rather does not confirm regular ovulation. It does not confirm adequate luteal phase, and it may not be consistent from cycle to cycle, right? So be wise because hormones fluctuates and timing of testing matters. What about semen analysis? What about semen analysis? A normal semen analysis does not assess. Now, first, what does it assess? What does semen analysis assess? It assesses sperm concentration, you know, semen quantity, sperm count, sperm morphology, sperm motility, pH, and so on. Now, all these things I just mentioned will be tested in semen analysis. However, if it is normal, that semen analysis does not assess DNA fragmentation, which spells the quality of the sperm. Right? Remember, I was talking about DNA fragmentation with respect to as you grow older, right? Why? Because quality of sperm is dependent on age. What do you say? From 40 years, quality of sperm begins to decline. It does not decline drastically like you find eggs. No, but it does decline anyway. So A normal semen analysis does not assess DNA fragmentation. It does not assess oxidative stress, which is impacting the sperm quality. It does not assess functional fertilization capacity. Now, in the first season, we talked about the journey of sperm towards fertilization. So when you do the semen analysis, it does not give us the idea of how capable, right? But it gives us enough information to predict what should be, but it does not give us um, its capability to get to the finish line, right? Up to 30% of men with normal semen parameters still have fertility issues. So that's why I will encourage men to always be in the live stream, because some will claim that they've had babies before and therefore they cannot be the problem. And how old is the baby? 10 years old. Oga, you can still be the problem. Is that okay? Yeah, we've talked about hormonal levels. We talk about semen analysis. What about ultrasound findings? Thank God for technology. Ultrasound will help to look at the structure, evaluate the structure of the pelvis and all the pelvic organs. Now, a normal looking uterus and ovaries will not rule out endometrial receptivity issue. Remember, we said when fertilization takes place and an embryo is formed, that embryo has to implant in the endometrium, and the endometrium must have the capability to receive it. Otherwise, pregnancy will not happen. So, but when you do your ultrasound scan, the ultrasound scan do not rule out the endometrial receptivity. So you can have a normal scan, but yet there is a question mark on that aspect that cannot be assessed, right? It also cannot rule out microscopic inflammation. You can only deal with what can be seen. But when it's now microscopic, you cannot see that. What about some people with subtle adenomyosis? For those of you who have gone for fertility treatment and stuff, you may have heard things like adenomyosis before, right? If it is subtle adenomyosis, it may not be accessible. So you can see there are things that the level of technology now may not be able to assess. So you can actually be given a normal test, but after all this time, no pregnancy, no pregnancy, right? All right. So I said that I said all that imaging, like when you go for a ultrasound scan, only sees the structure. It does not see the function of those structures that has been examined. So you can have a clear ultrasound or tube may be patent and all this, but it's not the function we are assessing. So let's now even talk about the tube. What about the tubes? Tubal patency tests. A lot of people have said, I think since the past few weeks, a lot of people have been coming to say, oh, my tubes are blocked. One tube is blocked, two tubes is blocked, and all that. Tubal patency tests. Well, let's talk about those who have their tubes open. Understand that even when you do the test and the tubes are open, patent, right? It does not always mean that the tube have normal motility. Remember, I think most of you heard that here for the first time. the tube has its own gentle movements that it makes, all in support of fertility, right? So when we do the patency test, that's the HSG that you do, it does not always mean that the tubes. It means that the tubes are open, but it does not always mean that the tube motility is assessed. It's normal. It will not also mean that there is healthy ciliary function. Okay, what does that mean? We said this in the first season. Inside the tubes, the tubes are not just one smooth tube, just like you would imagine. No, inside the tube, they have rough walls, and these rough walls are like maybe the appearance of your towel, where you have tiny projections. We call that cilias, right? Hairs. What's the function of those hairs? They beat. They beat like this. The whole idea of their beating is to propel the egg towards the direction of the sperm. All right. So even when you do your HSG, we still may not know whether those hairs are healthy, because they've got to be healthy. A lot of things are involved. They've got to be healthy for you to have a successful fertilization. Yeah. Now you have a patency, you have a patent tubes. Both tubes are open. Right? It still does not always mean you sending me a request. Still does not always mean that there is intervention. So even though your tubes are open, fertilization can still fail. Fertilization can still fail. Why? Because there is the tubal movement, there is the ciliary, the hairs within the tubes that needs to be healthy. There is a possibility of adhesion. So that tube does not necessarily mean that hey, you are good to go. That fertilization can still fail even if you have your tubes are open. So that is why we're now bringing your attention to what could go wrong. Normal test and yet no pregnancy. Why? Why is it so? Now, this is categorized in what we call unexplained infertility. Everything is normal, yet I'm not pregnant. It is under the category of unexplained infertility. Remember, I said the fertility generally, the male factor constitutes 40% of the problem. The female factor constitutes 40% of the problem. Then the unknown factor, which is the unexplained infertility, is 20%. Right? And actually, global statistics basically, the unexplained infertility. But long story short, even if we say it's unexplained infertility, it still does not mean that nothing is wrong, and it still does not mean that something is wrong. It's just unexplained, right? So you want to look at it from the perspective that currently we do not have the tools or the technology to identify the problem yet. So you go to God, right? You go to God. I say that all the time. If we've done everything we need to do, you still don't get results, you have to wait on God, because we can only be we can only get results as far as our technology can permit. Is that okay? All right. So who is still here? Long story short, long story short, fertility, requires one good egg. Listen, not just egg. Fertility requires one good egg, one good sperm, one good moment, right? And one good receptive uterus, right? So all this is what will bring you the result. So what did I say? Fertility requires one good egg, one good sperm, one good moment. Like one time years ago, I had to deal with some issues around some teenagers, I think, and the lady was pregnant and stuff like that. And the young man claimed that it was just one time, right? And he was so serious about it. But that's all it takes. Just one good moment. That's all it takes. Right? Where the good egg, good sperm, one good moment, and the good reception of the uterus, bam, now you're pregnant. Right? But all the things you do in your test is just a snapshot. Right? Understand this. And that is why we come every day to help you understand what's going on. Conception is a process. Just like you're on a journey, you have a camera that you say, oh, in this journey I want to be taking pictures, right? Remember, the journey is a process, but all you can take is a snapshot, right? Momentary snapshots along the way. So that's basically what the test does, right? But you are in a journey. So what if you are taking snapshots at the times when you may just be missing the problem? So understand it's a process, and follow us when we give you the 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 guide so that we can all get the results together, right? Let's guide you properly. All right. I know when it comes to this matter that everything is fine, normal test, no pregnancy. Patients often feel invalidated, Some are afraid to even ask more questions. When they no can go here, the one where they no plan for, right? Some others will say, maybe I was not resting enough, that kind of thing. So several things which I will not speak, but the truth of the matter is these things I'm talking about are the kind of things we want to cure with this TTC league coming in April, right? Just in case you're going to miss something, we'll be we'll be there to see how we can help you not to miss it. That is why we need your cooperation, your participation, so that we can be able to 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 take you through that journey and achieve the results you want for. Right? So do not despair, because um when you do test, it's not one size fits all. Right? You understand that biology varies. The biology varies from time to time, from individual to individual. Right? It's not one size fits all. There's somebody who send the result from 2023 that they said everything is all right, but that's 2023, right? So we want to reset the result. For those of you that are consulting, that are coming for consultation, understand that it's not your result from ages past. It's today. So that's what you want to do, right? And if you're still having issues with subscribing, right, you want to talk to me in the DM so that we can give you alternatives. Is that okay? So I was saying that biology differs. There's also the difference in environmental factor over time, and that is why I still insist that those men who will say that they've had kids in the past and now they cannot, the woman is the problem because they can't, it's not true. It's not necessarily true. That's why both should be tested at the same time. Pretty gold here. That factor would have changed. That's why you have a challenge now. So let us help you correct the environmental factor. I'll give you the result. Right? What about age distribution change? Age distribution. Remember, I've always, especially couples that are older, right? That are older, right? You want, if for men you want to boost your sperm, right? So get results. Why? Because what it will take you to to impregnate a woman older in her 40, 35 and above is not the same thing that it will take you for when she's 25, right? So you want to boost, if your spouse is close in age range with you, boost your sperm and get your result and move on with your life, right? And also there is unequal access to um, diagnosis. For example, those in Africa, there are lots of limitations with access to to the technology, right? But we are still doing our best. We are still helping, right? Vis-a-vis those abroad. Unfortunately, those abroad have their own challenge too because of the way they operate there. But if it's not working for you there, come home. It's cheaper, right? Cheaper. Anyway, long story short, whatever you have done, make sure in the end you want to track your cycle, you want to change your lifestyle. That would mean also adjusting your environment. You want to time your intervention, right? And also go for close monitoring so that you will know when to intervene and when not, right? So the most important thing in this gist tonight is to introduce us to the TTC League, right? What TTC League will help us to achieve is the dynamism of your of the fertility journey, right? Even it's possible to miss some things, but when we're in the league, we'll be able to help you. So just know that normal test means nothing is obviously wrong. We cannot see anything that is obviously wrong. That's why we tell you it's normal test, right? But again, it still does not mean that nothing is wrong at all. It's just that we cannot catch it now. So part of what TT League will achieve from April is, even if we didn't catch it, we are going to do something in our activity that will help us fall into the mark and you get your results, right? Is that clear? If you are still here, just type clear in the comment section. If you are just coming, do not say anything because you did not hear anything.